Managing how you choose to prescribe for any patient can sometimes be a challenge. If you have any sniff of getting a prescription from two doctors at the same time...
I promise you that's not going to happen. This is just a misunderstanding.
Promises don't cut it.
Patients who have a positive outlook on life are a pleasure to work with.
We have a laugh because just as they patch me up with one thing, I get something else. Always fancied a lobotomy.
Behave yourself.
I think it's quite difficult sometimes to realise that there is only a certain amount you can do.
And I'm just so frustrated to see somebody deteriorate so much in 6 months. It's soul destroying.
Does it hurt you when you go to a wee, Charlie?
No. He goes for a wee a hell of a lot. Why do you go to a wee so much?
Hey, Chris, how are you? Okay.
Farnham Surgery's been to Pam. How can I help?
Hello, it's Dr. Hyder. Come through and have a seat.
You all right?
Fine, thank you. And how can I help you today?
Oh, I had a really serious accident on a Thursday. I got my legs crushed.
OK.
So...
At work or...?
At work, yeah.
Right, okay.
I was, hard to explain to everyone. I was sitting... Oh, it's not sitting down, but I was working with my legs in between two rollers and cargo systems. Somebody activated a lane and a pallet, my legs were sitting down like that, crushed my legs against the rollers. How can I explain it to you? Let me just get up. So if I was, by the time the roller bed come, I was like that, against the rollers.
Oh.
The pallet's coming from behind and crushed my legs.
Right.
And literally...
It's me.
So yeah. They would have been taken, it's 4 ton. So they would have taken them clean off.
Goodness me.
So it's a lot of it's psychological at the minute as well, because it's I get flashbacks on that. Scary. Obviously, I can't work at the minute.
You've got a lot of bruising there.
Yes,
as well.
it's coming out today.
And this cut as well.
No, this leg is actually not too bad.
But that happened at the accident.
That's just pressure. I mean, I had an X-ray on Thursday.
Did you?
Yes.
Yeah.
And there's no broken bones, but she said there's a hell of a lot of swelling.
Is it painful on the shin?
The pain, that's not too bad to be fair, but it's when I walk around, it's more internal. So I started to pinpoint where it is. It's only when I put pressure on it and weight in it. I can sort of walk around all right, I just take that for support.
Yeah.
But I can't get upstairs properly. My job obviously involves me climbing up ladders, steps, because I'm a maintenance electrician. So...
Yeah, can you bend your knee okay?
Yeah.
So the knee bit's fine?
Knee bit's fine. Here hurts. That really hurts there.
Yeah. And the X-ray, there was definitely no fracture?
No fracture, no. You've got to think, my legs must have squeezed to the side of my arms.
It's unpleasant, isn't it?
It is, yeah.
So you need a sick note. Do you need pain relief?
I probably would, yeah. And something, anti-inflammatories or something that help?
Yeah, I think it's pretty extensive bruising, isn't it?
So the bruising's coming out, so...
I think a couple of weeks would hopefully mean that the bruising will start to settle, but soft tissue injuries, they can take up to 6 weeks to resolve altogether. I've given you the cocodamol. You can take a maximum of 2 tablets up to 4 times a day. And then that's your sick note as well. So I've just written crush injury to both legs at work.
Thank you.
And we've done it from the 22nd to the 8th.
Thank you.
So if you're no better by the 8th, then come back and we'll see you again. And if it's worse, we can always see you soon. Yeah. All right.
Cheers. Thank you very much.
That's OK. Take care then.
Thank you. Bye-bye.
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 I don't want to waste 4 hours at Wexham Park, but at the moment I'm having severe facial problem and hitting my right arm, and I don't want to go to Wexham because I'm one of those patients that has fibromyalgia type things.
OK.
So is there somebody I can get checked before I go?
Just a minute.
This is not affecting my voice at the moment. It's affecting my lips, my tongue. Normally it just goes down here. It started with a headache, which I've still got, and it's going down the left side of my body, slowly but surely.
Have you had this before?
No, not like this.
My daughter, she's travelling.
Yeah, it's going slowly affecting the nerves down the side of my body. I don't know, that's what I'm worried about.
A month ago and said I was having a stroke, and I was.
It won't surprise me.
Okay, thanks.
If you take a seat for me, and I will just quickly speak to the doctor.
Okay.
Yeah, thank you. So it's not, yeah. Not an install.
Come in.
Hi.
Tell me.
She's, I don't know if she's having a heart attack, lady, but her whole left-hand side is going numb. She's got now a tingling in her tongue.
Let's get the ECG for her. Okay. Who is doing the merge treatment room?
Hello.
Alison, good afternoon. How are you today?
I'm good, thank you. How are you?
I'm fine, but one of my patients could be having a heart attack. I want an ECG done.
Okay then.
She is Karen Price.
Okay.
And shall I send her towards you? No.
Yeah, straight down towards 10.
Yeah, I'll take her there.
Thank you.
Thank you.
Thank
Cheers.
you.
Bye.
When she's done with that?
Sorry?
When she's done?
She can come straight.
Come here, yeah?
Yeah.
Okay, thank you.
I haven't had anything like this before.
Yeah. Your speech seemed to be okay.
I don't know, my tongue's all
No.
starting to
I had
tingle.
I mean, I know it's sort of the best thing to tell you, but I had a minor stroke a long time ago.
That's what I suspect this is.
10, 15 years ago. But I didn't know what it was, but my face started drooping from one side. I was really stressed, that's what I had.
Could you follow me? You okay to get up? Yeah? Sure. Don't worry, you can go slowly.
So just follow my finger, okay?
Stick your tongue out and waggle it from side to side. That's fine.
Open your mouth, show me your teeth.
Sometimes I can smell burning when there's no burning.
Okay.
Are you checking that I've had a stroke or something?
Come in. Hello, come on, have a seat.
There we go, thank you.
How's it going?
I've been having headaches on and off for a little while. And today I had one at about 5 to 2. And as I was driving home, I got a pain down here. And it's now getting gradually worse. And my arm and leg don't feel...
Is it feeling very weak?
It's not so much weak as though it's not quite there.
Quite there. When you had previous heart attacks, what were the symptoms like? There was mainly chest pain,
I had
wasn't it?
chest pain. This is nothing like...
ECG is absolutely normal,
that's what the nurse
which is good news in a way. Have you lost any power in your hands and legs, or it just feels like that?
It just feels they're lighter than this side.
Okay. Can I have a quick feel of what's going on? Examine you.
Yeah.
Try squeezing my fingers tight. Tight, 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 tight. Okay. In any urgent or emergency situation like this, it's important for a healthcare professional to be level-headed and calm, mainly because patients are in a state of anxiety. Okay. Push me away. Pull me towards you. Like this. Hold it like this. Push me towards you. That's good. Okay, I'm just going to quickly have a look at your eyes. Quite often, it's very easy to succumb to the pressures of the emergency and get the anxiety and the fear transferred onto you. And then the patients won't be reassured and they will lose the confidence in the healthcare professional. Hence, I was calm and level-headed. Close your eyes tight, 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 tight. Good. Clench your teeth for me. That's good. Oh, thank you. Sorry about that. So mainly at the moment, it's like headaches on the left side, tingling sensation, and feeling weak.
Yeah, I'm tired. It's like somebody's hit me with a baseball bat on the side of my face.
Thank you. Based on your symptoms and the scoring system, it would put you on some risk here. We need to exclude if there is any phenomenon like mini stroke. It might be worthwhile speaking to the High Wycombe Stroke Centre what they think we need to do. Is that okay?
Yeah.
Thank you for your call. We are experiencing a high volume of calls and all available operators are busy. Please hold and your call will be answered shortly.
Doesn't seem like we're having any luck today.
So if you are having a stroke then?
Well, if there are fast symptoms like complete weakness on one side, tingling, facial droopiness and everything, we advise patients to call 999. High Wycombe is the stroke centre. That's where we get on-the-day investigations like MRI scan and everything. That probably is the way forward. As soon as they see this letter and everything, they'll be happy to see you in High Wycombe anyway. Is that okay?
Yeah, yeah.
Shall I give that to you?
I'll take that. Thank you.
All the best. Hopefully it's all going to be okay, all right?
Okay.
Take care. Bye-bye. I've got bloody animal fleas on me. They're all little tiny animal fleas. 2 of them just jumped on me. I don't know where they're from. Well, they're from somebody. You've got birds and squirrels and chipmunks. You're not enjoying any of it, no?
At the moment, I'm not. I can't. Yes, I can't even get out.
Charlie Williams, please.
Hello there.
Hiya.
Come in. Sorry to keep you.
That's all right. Sit down.
Hello, Charlie. He's had some pain.
Yeah, lower abdomen,
Okay.
right in the middle. Now, he's had this a couple of times over the last month or so, but it's not been to the extent that it was this morning. It's coming again. He said the pain is always there, but it like spikes.
Yeah.
And then he's doubled over and it's like cramping and stabbing.
Yeah, okay. And when you do a wee, does it hurt you when you go to a wee, Charlie? When you do a wee?
No.
Doesn't sting. Good.
He goes for a wee a hell of a lot. Like, he'll go in the space of an hour about 5 times. I'm like, why do you go to the wee so much?
Sometimes boys, their bladders are slightly sort of weaker than women's, and you find that they tend to sort of go and they sort of go out of that. Now, if he's not getting any pain, it's unlikely to be an infection, but I think it's worth trying to get a urine sample at some point and bringing it so that we can test that. You haven't had any diarrhea when you've been to number 2?
I have had one.
That was a couple of weeks back.
Oh, a couple of weeks ago.
1 week ago.
1 week ago.
1 week ago?
No,
okay.
I think it was a couple of...
I had to have toast.
It hasn't been constipated. It's not been like when you go on lots of little hard things and difficult to get out.
No.
No. Can I have a look at you and your tummy up on the table? Shall we jump up? Let me get this for you. Good man.
That's a good
Lie down. Good. That's good. Just open wide for me.
It was really warm this morning, actually. I've given him some Nurofen.
Relax. Just check his temperature and open that up. Okay, that's fine. And then that way. 36.4, so that's okay. Let's have a little feel of this tummy. A wee bit sore down here. Sorry. Have you had lots of wind? You're a bit windy, aren't you?
Yeah.
Yeah. Come and sit up again now. He's obviously getting some crampy pain and the bowels are quite active.
Okay.
So it sounds a little bit more like he may be getting a little bit of a bowel infection and he may end up in a bit sick or get some diarrhea again with it. Sometimes very early things like appendicitis can present just with general tummy pain. And at the minute, there's no indication that that's what it is.
Good.
I would continue doing what you're doing, give him some Nurofen.
Okay.
A little bit of whatever he fancies to eat and a little bit of fluid every so often.
Don't tell him that. I'll be asking me for ice cream for lunch.
Yeah, whatever, in a sense, whatever he'll take. If he's getting worse or going downhill, bring him back this afternoon so we can just do a double check and make sure it's not anything like appendicitis or anything. But if you can get a urine sample, it's worth just, if you do, dropping it in so we can just check.
Got a pot or anything?
Yeah.
Thank you.
What am I going to have to do?
Oh, lovely.
Okay, young man.
Say thank you to the doctor.
Thank you very much.
Pleasure to meet you.
Okay.
Okay.
Brilliant. Thank you so much.
Okay, not at all.
Cheers.
Well done, well
Some of
done.
them were ones.
Sorry, Doctor.
It's okay, Leslie. Come on in. Sorry, I'm running late. So, last time I spoke to you, I got you in to see Dr. Javed because you said your chest was worse, yeah?
What did they say you've got? What's your diagnosis?
Avian lung disease.
Hypersensitive to birds.
Well, they told me to get rid of my birds because I had about maybe 500, 600 different types of birds, which I can understand was giving me this problem.
They think that you've reacted to the birds and they think that there's damage in... Well, the blood tests show that he reacted to the birds. I've seen it on the screen.
exactly.
He keeps saying it's not the birds, but what I mean is that they think there's some damage to your lungs because of the exposure to the birds. Yeah. Okay. So we need some advice from the chest physicians about how we move it forward. That's the one that we can't get you an appointment. So twice we've got them to rearrange it, and twice they've cancelled it. I can keep chasing.
I've told him that the doctor can only do what she can do.
Yeah. So what I can do is escalate it, and we've escalated it from this man's appointment was cancelled because of the doctor's strike and you haven't booked it, please book one, right the way through to an urgent referral being faxed.
Yeah. One of my main concerns at the moment is his depression. This man is getting more and more depressed every day. He's been my friend for a long, long time, over 13 years. He talks suicide, he talks all sorts of things, and I'm just so frustrated to see somebody deteriorate so much in 6 months. It's soul destroying.
What am I going to do? I mean,
it's two things. Yeah, there's the depression because you're feeling so ill, and there's the fact that you're on a high dose of steroids, which will make you depressed. Yeah. And every time we try and reduce your steroids, your chest flares up. If I could stop your steroids, that's what I'd do. But every time you try and drop them, you really struggle, don't you? We've spoken before about the fact that they won't constantly do scans and x-rays, but what they need to be doing is deciding what they need to do. Yeah? What I want them to do is tell me about your medication. Yeah, because I think that if we could change the sorts of steroids you're on or reduce the amount of steroids you're on, then I think that a lot of the other symptoms would improve.
But the trouble is, one of your biggest things is you do just need to. I know it's very hard, but you need to just relax about what's going on around you medically.
It's very hard
because everybody's doing the best that they can do.
Well, you know that, don't you?
It's very hard on your own because your head you start thinking the worst all the time. Your head, I seem to think the worst.
Well, that's been one of what they think you have would account for your symptoms. We're just really struggling to control them at the moment. From the point of view of chasing the chest physician, I will do it again.
Thank you very much, Doctor.
And I'll see you then. No, it's fine. It was nice to meet you, Pam.
I mean, he just gets very frustrated, and I mean, I know he's got all these things, but a lot of his things are exacerbated by anxiety. I know they are. Bye, nice to meet you.
Bye-bye.
How are you doing?
Yeah.
Let's take a seat. So, there's a few problems.
Yeah, I heard.
Yeah.
I've sorted it out. They were supposed to have a script for me just in case I didn't get what I got from you. And like I said to you, they only give you 5 minutes, and I said to them, yes, I got from Dr. O'Donnell, but you only gave me up until the day I got to him.
But the doctor says that...
I know, she said, I chatted to the owner.
You told them you hadn't seen a doctor here.
No, I told him I have.
2 weeks before this consultation, Yasser came back to the practice and saw me after an absence of 2.5 years. He told me that he had moved back into the area, and so this was the first time that I'd seen him. His problems are dependence on opiates and benzodiazepines. The reason he came to see me that particular day was for his prescription for diazepam. But he omitted to mention that he'd been to his previous GP 3 days before and had gotten a prescription.
She's trying to say, I've got a script from there and I've got a script from here. And I said, it's not right, it needs to be sorted out.
Why did you go back to Dedworth at all?
They rang me and said...
But you should say, I've moved to a different practice. I've read
I said that. I said it was about the script.
Yeah.
They said to me, come get the script. And I said to him on the phone that I don't need it. I'm with Dr. O'Donnell, because she phoned me and said, no, you've got 2 scripts. And then I was like, what? And then I went there and then sorted it out. I took my dad with me because of proof. And then he went in and then he chatted as well and goes, look, my son didn't do that.
Well, it does look very suspicious. It damages trust.
Morning, ladies.
Morning.
I have an appointment, Walter Godley.
Take a seat next door. Take a seat next door.
Thank you.
Seeing lots of gentlemen today.
Sorry?
Seeing lots of gentlemen today. It's making a change.
So this is your third one?
I've switched off because of the children in there.
Yeah, it gets too much.
They're a bit noisy.
What do you want to see the nurse for?
Because I can't hear.
You can't hear? Right.
How are you?
I can't hear a thing.
All I can hear is like a whining noise. Yeah.
It's Dr. Bajwala.
Is it a lady?
It's a man.
Yeah, man.
Right, how can I help you today?
I've lost my hearing right here.
Right.
Part of my hearing right here.
Sorry, what happened?
Sorry?
What happened?
Saturday or Sunday, I put my finger in me and a brown blob of wax came out of my ear. And then maybe Tuesday morning, the hearing sort of like went about 90%.
Okay.
Last night it just kept going and coming and going and coming.
Is there any discharge? Why you put your cottonol?
Not since the weekend.
Okay, so what's the reason you've had your cottonol still there?
The wife put some olive oil in last night.
Oh,
and said,
okay.
Don't take it out.
You should never put the cottonol because it will absorb the oil. Okay, let's have a look. So have you taken any painkillers?
Sorry?
Have you taken any pain relief?
Yeah, I'll take some paracetamol. No, it didn't work.
Do you use earbuds?
Sorry?
Do you use earbuds to clean your ear?
I did try a weekend.
With this year or that year?
That year.
Okay, so you never...
I've got no problem with that ear, except for partial deafness anyway.
Yeah, because your ear looks a little bit perforated. Let's have a look here. Never use cotton buds.
Oh.
It looks a little bit infected as well. Okay, there is a little bit of infection there.
Oh.
Sorry. So what I'll do is I'll give you some ear drops. It looks a little bit infected.
Sorry?
There's an infection there in your ear. So I'm going to give you some antibiotic ear drops and some pain relief. I want you to come back and see us next week, Monday. There's a little bit of cottonol hanging out. Let me take that off. Yeah, so take some paracetamol. If that helps, carry on. If it doesn't, come back and see us. Okay?
So you want me to make another appointment?
Next week. Anytime
Do you want
next
me to
week.
make an appointment for next week, or do you want me to make an appointment next week?
Make an appointment next week.
So next week, if it's still there...
No, we still need to see you.
Do you?
Yeah.
So I'll make an appointment now?
Yeah.
I'll
Before
make
you
an
go.
appointment for next
If you
Wednesday.
can, yeah.
I'll do that.
All right?
All right, thank
Take
you.
care. Bye-bye.
It does look very suspicious. It damages trust.
I could regain the trust and I could bring my dad here. And
No, it's not your dad, it's you. The trust has to be with you.
Yeah.
Because, if there's a hint that you may be working the system.
No, I'm not.
No, but if there's a hint that there, so it is up to you to make sure that everything is absolutely above board and that it seems as if it is, that it's apparent and clear to everybody that it is above board. But if there's something that's not right about it, then that interferes with the trust between you and me and between the trust between you and all of the doctors who are available to help you. And so...
I'll promise you, I will, if I get medicated, I'll promise this will not
Well, you can
happen.
promises...
I'm saying it's I'm away from there.
Yeah, well, promises don't cut it. We have to be sure, in terms of safe prescribing, that that's what's happening. Managing how you choose to prescribe for any patient can sometimes be a challenge. In substance misuse, sometimes people are in this situation because they're afraid of being without their medication. Duplicity or deception isn't what they're trying to achieve, but it's their way of making sure that they're not going to go without. Our concern is not so much the deception, it's making sure that they're not unsafe and that in particular we're not contributing to a reduction in safety in prescribing. The point is that twice, on 2 occasions, you've gone back to Dedworth after you've had medication prescriptions here, and you've said that you didn't get a prescription here. And that's twice, yeah.
No, that's impossible.
Well, I'll have to check this out because I can't issue a prescription unless I know what I'm doing. Do not go back to Dedworth again. If you have any sniff of getting a prescription from 2 doctors at the same time.
I'll promise you that's not going to happen. This is just a misunderstanding.
And what we'll do is we'll need to put you on daily prescriptions. I know, but this is not my doing. This is you messed up here. And if you continue to do this, then we have to go down this route anyway, because there's no way out of this. So
I have to come every day?
No, you have to come to the pharmacy every day and pick up. And if everything is going well, then we can begin to relax the control. But that's what we have to do at the moment.
Thank you very much, Doctor.
You're welcome. If they have any problem, they can ring up from the pharmacy.
Yeah, and you can keep a check if you...
Yeah, I will. I'll be watching it closely,
I want you to regain the trust with me because I've known you for a long time.
It's important,
it's important. I want to keep that trust. I don't want you to look down on me.
No, I wouldn't. I'd never look down on you anyway. This is just purely a question of trust.
Yes, that's what I'm getting at.
It's really important you don't mess up.
Yeah, so I'm going to prove to you that I wasn't. And
Do.
We'll take it from there.
Yeah.
Thank you very much.
Yeah.
Thank you.
You take care.
I'll see you in 2 weeks.
Yeah, absolutely. Yeah.
I used to sing in school.
Did you?
I used to be a big Britney Spears fan, so if we used to go places and then if something was getting delayed, my teacher would be like, go off stage quickly and sing a song. Oh my God.
I'll sing us one song.
No.
Please.
No. I was in dancing as well.
I remember when my eldest joined the choir and she was tone deaf and I used to say to her, mine. Don't sing, just mine.
How can I help? I had a lot of issues with my stomach. It was diarrhea continuous. The last 3-4 weeks I was suffering. Okay. The doctor done some test. The stool. That's correct. And still same issue because I was suffering with overactive thyroid, but my thyroid levels are perfectly fine. Good. Because if the thyroid levels are played up, that's what happens as well. Then it's another issue might be. Still, I'm in the same issue. It's not getting better.
Okay. Your stool sample was clear, so that was good. Right. Okay, but let's go through a couple of things. How long has the diarrhea been going on for now?
We're talking about 1 month now, isn't it?
Okay. And 4-week history of diarrhea. How many times a day are you opening your mouth?
Christ, sometimes back to back. 6 times.
6 times a day.
Easily.
Yeah. 6 times per day. Any blood or mucus?
I didn't see it. I should have, but I just...
Any vomiting?
No.
Any tummy pains?
When I have to go, it start rumbling. I'm ready. It tells me, come on. That's it.
You need to go and open your mouth.
That's it.
And then you
after that,
after you open
and then
your
after,
mouth.
just calm down.
Any weight loss?
I tried to lose weight anyway, which I successful last because last year I was 95 and now I'm 85 now, which is I want to do it because I cut down all the processed sugar and everything from my.
And you've been
diet.
Exercising as well.
Exercise, I do lots of exercise. Yeah.
Okay. And have you been abroad recently?
No.
And anyone in the family have any bowel conditions like inflammatory bowel disease, ulcerative colitis or Crohn's? Can I have a feel of your tummy? Just going to gently press. No pain anywhere in the tummy? Nothing. That's good, okay. One of the examination that we should do if someone's getting persistent diarrhea is examining the back passage to make sure that there's nothing worrying that we can feel in the back passage. Are you happy for me to do that today? Yeah. Okay. Now what I want you to do is lie on your left side and bring your knees up towards your chest, okay?
Hello. Hiya. Come through, have a seat.
Thank you.
How are you?
Everything was fine today, yesterday.
Yeah.
I've seen the midwife, community midwife, because I just got the birth 3 days ago.
Congratulations.
Thank you. So everything was fine, but my boobs, they're a little bit swollen. And what she says probably is infected.
Okay, so they're painful and they're swollen.
Painful, they're swollen, they're big.
They're getting red?
Slowly but surely.
Okay, any temperatures?
I don't know, I didn't check it, I'll be honest.
Okay.
I was so
Do you feel
panicked.
well?
I feel okay, but it's painful, it's very painful.
Are you breastfeeding?
Not now, I think, because I'm just scared to do it.
Okay, but you have been?
Yes.
So you've been expressing milk?
Yes.
Ah, okay, fine. Okay, let's just check your temperature. And baby's okay?
Baby's okay, she's doing well. So I can't complain about baby, it's just me.
Perfect. That's normal. Do you want to come behind here? Okay, I just need you to take everything off, including your bra. Just sit on the couch, okay?
They're so big and wet and painful.
Okay, I'm going to have a feel. Okay.
Already they are painful.
All of them?
Mm-hmm.
Very swollen, aren't they?
Mm-hmm.
And tender.
And I have to say, yesterday was like half. Today morning is like double everything.
I think this one's worse than this one. This one still has some...
It still is painful. For me, it's both same if it's about pain. Maybe it's...
And the milk's coming out okay? Sorry, just
Yeah.
1 second. It's coming out okay? Yeah?
Mm-hmm.
That's fine. Get yourself dressed. So, yes, they are swollen, they are tender, and they are slightly red in some areas and very warm to touch. So I'd like to give you some antibiotics just in case there's an infection going on. So I'm just...
I don't think so. I can cope another day.
Okay. It's 1 tablet 4 times a day.
Okay. So if I had the antibiotic, can I still feed the baby?
Yeah. The one that I'm going to give you is fine to take while you're breastfeeding. Okay, so it's absolutely okay to do that. They're not getting any better or it's still the same. You need to come back and see us, definitely. All right?
Okay.
There you go. All right.
Lovely. Thank you so much.
No problem. Bye-bye.
Thank you.
Bye.
Okay. Essentially, it was reassuring. Okay, so when anyone gets persistent diarrhea, there's lots of things that we think about. Okay, so obviously one of the things that we've got to rule out is infection. Okay, and normally, like I said, it settles down, but it's good that we sent the stool sample off. There was nothing that was shown in that stool sample. The other thing that we think about is inflammation. So there is another stool sample that I want you to do to look for inflammation in the bowel that can cause these types of symptoms. Does that make sense? Okay.
Yes.
The other thing, of course, that we think about is anything worrying going on, okay? And normally it would, there's lots of different signs and symptoms. So persistent diarrhea with blood, weight loss, etc. Does that make sense?
Yeah.
And there's a couple of other blood tests that I want to add just to make sure that we've ticked all the boxes to make sure that we've investigated you thoroughly. Does that make sense? After these investigations, if the symptoms persist, then we may need to get you up to the gastroenterologist specialist to have a look and see what's going on.
Okay.
Lovely.
Doctor, thank you.
No trouble.
I need to get to the bottom of this
Yes, absolutely.
issue.
So I'll see you in 2 weeks. Yourself, I'll see you in 2 weeks, and then we'll move things forward from there. All right, then?
Thanks.
No trouble.
Thank you.
Lovely. Lovely to see you. Bye-bye now.
Trying to avoid that big blood vessel.
So it's painful. Oh, yeah.
Oh my God, no, don't go any further, please. That's really hard. Oh my God, no, please.
Okay,
oh.
so it's aggravating. I'm sorry.
How can I help?
Oh, just a couple of things really.
Yes.
First thing, I was in hospital again at the
Yes, I
weekend.
read.
The week before I was in, and then again at the weekend, and they actually tried me on different antihistamines, domperidone.
Oh,
I've got
yes.
them with me just to show you, make sure I got the name right.
Yes.
They actually gave me some that were out of date, so I needed some more.
Okay.
I don't know how it ends, there's so many they have to deal with, but just it worked quite well because cyclotine makes me feel a bit sick before I feel better. But apparently these have their side effects as well, so I'm quite keen to try them.
You can, but in some people, these can have these kind of psychotic episodes where they get certain spasms of the neck and that kind of thing.
Oh, wow.
It tends to happen more in in children. I can give you a short course now, but I think it's for when you have the flare-ups.
Yeah.
I think long-term, stick to the cyclizine safer.
Yeah. Tolerance to the other two.
Samantha is a 24-year-old patient of mine with ongoing chronic abdominal pains. She's under a hospital in London with the gastroenterology team undergoing numerous investigations. However, she's still getting these chronic intermittent cramps.
Because I'm on a lot, I'm on tramadol, morphine as well.
You're on, so I've got hypropranolol. Are you still taking buscopan?
Yeah, 8 a day.
Are you still on cocodamol?
Yeah.
Amitriptyline?
Yeah.
Lansoprazole?
Yeah.
Citalopram?
Yeah.
And do you still need the Cosmocolt?
Is that the Movicol?
Yeah.
Yeah, I've got some at home. The hospital gave me quite
So
a
if
lot
I
of
go
them.
to add drug, it'll tell me whether these will interact as
So
well.
I'm on tramadol and I'm on morphine as well.
See, there we go. So
Oh wow, yeah.
but basically, having amitriptyline, citalopram, and domperidone, these affect the heart. Basically, that's the other side effects.
How often do you have it dressed, Queenie?
If you feel something sharp, tell me and I'll stop.
Yeah, I can slightly feel that. Actually, on my legs then.
Right, so there's quite a lot of discharge on the dressing.
Come in. This is Holly.
Hello.
She's with us for the afternoon.
Right.
Alan, could you sit up on the couch, please?
Yeah.
Just saves me bending down.
Of course I will.
Lovely.
But without being, just while you know I've got to drop your trousers, you know.
I'm happy if you are. Right, how's the legs feeling?
The right leg is on its 4th week, isn't it?
Yeah, 4th week.
If you have a look and you say it's okay, then I'm still on my 6-week plan. But the left leg is still a little bit oozy, but not much.
Alan has a condition called lymphedema. Lymphedema is a disorder of the lymphatic system whereby fluid is not being drained away from the tissues adequately. This can happen in any part of the body, and in Alan's case, it's in his legs. Alan's condition is lifelong. However, he has a very positive outlook on life.
Coming in for dressings regularly?
Yeah.
For a year and a half?
I used to come in every day.
Down to once a week now?
It's once a week now. It used to be every day, and Sheila would run and hide.
OK. So you're just having it put on like this with the yellow line over, are you?
Not on the right leg.
No, on this. We're just doing the left leg.
What that is, they put a little bit of the green.
Bit of green.
OK.
And then they've been putting the padding over the top of it.
Sure. It's really helpful if patients have additional support at home or family that will help them at home. Initially, Sally was doing some dressings at home to save Alan coming on a daily basis. And this was also freeing up appointments at the surgery for other patients that needed care.
So yellow lines just sort of essentially to hold it all on like a big sock.
Yeah. Right, this is my problem because I haven't got the strength.
Do you want me to get some gloves on and hold
Thank
things
you,
in place?
yeah. Maybe pull at the top would be easier for me, thank you. That's fine. OK.
That's fine.
Oh, dear.
I'm just watching.
Do you want me to do the second there?
No, it's fine. It's fine. Thank you.
I've been thinking about cake, and I've decided that I have to give cake a miss for a while. But I enjoy looking at it, but I'm resolved not to eat cake this afternoon.
So we won't force it on you.
Thank you. This is a bigger shock than Brexit. Yeah, Jim refuses cake. Yeah. It's such a shame.
I don't understand.
Look, this, I understand this. I have to slim down. Yes.
When was the hospital admission again?
I got out on Saturday, so I went in Friday early hours.
Is it for tummy pain?
Yeah, same as always. And the
Is it right or left side?
Right side,
Right.
yeah. They think it might be a valve for my pancreas, but they're not too worried about it yet. They're trying to get the pain under control.
Oh, the sphincter of the valve.
It's been
Yeah.
for 4 years now. They're trying to get the sphincter problem under control. If it is that, I'm seeing Hannah Smith on Monday to sort of get more.
So follow-up women at Hammersmith Hospital, is that next week?
Yeah, because I had Botox injected a few months ago now, beginning of April, and they want to see whether that helped or not. It hasn't, but they need to discuss
Where
it.
you had that
In
injected?
Hammersmith, they did an endoscopy, went back in, injected the sphincter muscle with the Botox.
Oh my goodness.
But it was trial and error, it's quite a new thing. Nothing's just ease the pain, but I was willing to give it a go. So now they might decide to inject more, or they might decide to try another treatment now. So touch wood, I'm just hoping something eases it, just so I can get back to work, you know. Just I want to get back to normal.
What do you
really.
do as your job?
I was in an office. I had a little office job, customer service, because I like talking. It was really good. But I had to let it go. I was a liability on my painkillers. I was not well. I had to let go.
And on these medications, are you driving at the moment?
No, I can't. I don't want to risk it. If I have an accident, I'd feel so.
Yeah, because some of these medications can make you drowsy, so we always have to advise against operating machinery or driving.
Yeah, that's one of the reasons why I had to leave the job, because it was in a warehouse. So obviously the machinery was going around and everything. It wasn't for me, you know.
Samantha is on numerous medications to help alleviate some of her pain. Some of them are to help her nausea, some are to help relax the bowel. Other medications she's on are opioid-based, like cocodamol and tramadol. One of the concerns that we have in treating young patients with long-term pain management therapies is that they can develop a physical dependence and even an addiction to certain opioid-based medications. Therefore, it's really important to keep these as a short-term use only at low doses and eventually try to wean them off these medications. And you're not taking any other illicit drugs, anything over the counter, herbal, nothing like that?
I try like multivitamins, but just to try and boost my immune system.
At the moment, carry on with the propranolol, the higher dose. I can see on the last consultation with one of the locum doctors that they put you up to 20 milligrams. Carry on with that 3 times a day. We increased your citalopram to 40 milligrams.
Yeah, I'm happy on that now.
So carry on with that, and I think let's see you again in 4 weeks' time with that.
Please,
And with the domperidone, as I said, it can affect the heart. There is side effects. I'll give you 7 tablets just for the 1 week now, and then after that, carry on with your cyclizine. Is that all right?
That's fine,
So just use them in an emergency if and when you get a flare-up. Is that all right?
That's fine. Thank you.
So let's do that.
It's just sort of keeping me comfortable to find out what's going on, you know.
Sure. There you go. Take care. Nice to meet you again.
Oh, thank you.
Oh, take your time.
Straighten up. Thank you very much.
Take care. Bye.
Do you want a job, Sally, over the summer?
I've got 2 weeks off. Starting from Friday night. Well, if you ever get stuck over the next 2 weeks...
Bless you.
Just let me know and I'll come in and help you.
We have a laugh because just as they patch me up with one thing, I get something else. I was rushed in for a triple bypass.
No.
Yeah.
We still can't get rid of him that way, can we?
Yeah, as soon as they're healed, I'll think of something else.
Oh, jeez.
Always fancied a lobotomy.
Behave yourself. I remember when the very, very, very first time you
That was
came.
you and Dr. Morris.
And I hadn't been here that long.
No. He made that drastic mistake, didn't he? He said, oh, God, Sheila, I think we'd better book him into our surgeries.
Forever.
Forever, by the looks of it.
And he wasn't wrong.
Done.
All right, then.
Good job.
Right, is that it now, Sheila, for another 5 months?
If only. Right, so,
Have we got an appointment for next week?
Yeah, another one at 2 o'clock in the afternoon.
Yeah. Right, I'll have a look and see if that's me. I might just have a day's holiday. Right. Lovely to see you. Lovely to see you.
Get the bus down now.
Do you?
See you later.
Bye.
See you later.
Bye.
Bye.
I'll just leave the door for a minute.
Yeah, no, it's hot.
Because you have to put full stretch on it.
Yeah.
It's hard work.
Bye-bye, little man. Superstar. All right, there you go. Bye-bye then.
Thank you very much,
All right.
Doctor. Yeah,
Okay,
thanks very
nice
much.
to see you.
Yeah,
Thank
bye-bye.
you.
Right, thank you very much.
Best of luck, okay? Have a good trip. Bye-bye. Take care then.
Have a good day.
Bye-bye, you too.
I shouldn't really be so bothered about it, but it does wind me up with people just staring at it, you know, when you're out. And it's just completely, it's driving me up the wall.
Just to be clear, this clinic would be a clinic for people who we suspect may have a potential cancer. Okay?
Obviously, the sooner you can give birth to this and get this out,
That's
the
muscle.
better. That's muscle. Is it really?
Most people have six-pack. I have a barrel.